Hello, everyone. Good evening. Welcome to yet another session on Women's Wellness page. Let me just check if I've gone live. You can just say, wave a hi or say a hello and let me know. And also let me know if I'm audible. Yes. So I am live, and I today there's one topic that I'm going to talk about, which is really close to my heart. So, how was your week, first of all? It's midweek already, and time is just flying. You just don't realize how time goes by day by day. It's like crazy. So, the topic that I'm going to talk about today is something which a lot of people with endometriosis would relate to. So, very small incidents that I would like to highlight in this particular, which is very related to this particular topic, is last year, it was my sister's 40th birthday, a milestone birthday for which probably I was preparing for a very long time. I was planning it. And I wore a beautiful red gown, which was gifted to me by my sister. And I was like super excited about it. The party went really well. We all had fun. There were like crazy number of pictures that were clicked, and everything went perfect. The pictures, as a routine, were posted on social media. And boom, there comes a message on my messenger. Hi, congrats. When are you due? Then yet another congratulatory message saying that, congratulations, I'm so happy for you. And I just didn't know what to do. I mean, I didn't know whether I should be happy or sad about it, whether I should laugh or I should cry about those messages. So, millions of women like me suffering with endometriosis would understand what I was going through. So, for women with this particular condition, it is not very easy to conceive. For a lot of people, it's not easy. A big number of women with endo have trouble conceiving, yet keep getting such messages because of something called as endo belly, which makes you look pregnant even though you may never be able to get pregnant. It can come up anytime, and there is nothing that you can do about. So, I mean, how crazy can it be when you're like just prepared wearing a bodycon dress, a fitted dress, and suddenly your stomach bloats up? Crazy. So, what causes this endobelly or the bloating? There is something called as SIBO and dysbiosis. SIBO is small intestinal bacterial overgrowth and is a serious condition affecting small intestine. So it occurs when bacteria that normally grows in other parts of the gut start growing in the small intestine. That causes pain and diarrhea. Patients with SIBO vary in presentation from being very mildly symptomatic to having chronic diarrhea, weight loss, malabsorption, etc. The second condition is dysbiosis. That's a condition in which the gut bacteria become imbalanced, leading to a wide range of digestive disturbances, including bloating, diarrhea, constipation, stomach cramps, just amongst the others. About 96% of women with endometriosis suffer from high levels of bloating and gut issues caused by SIBO or dysbiosis, or both for that matter. We have more bacteria that are living in our guts than we have human cells in our body. And imagine the bacteria going haywire. So we have a balance of good and bad bacteria. The bad bacteria are the disease causing unfriendly bacteria which are present. So these good bacteria are involved in digesting food that we eat, producing vitamins such as vitamin K2 and biotin, converting the thyroid hormone into its active form, detoxification, reducing inflammation, reducing pathogenic form of bacteria, and energy production. It is important to keep a healthy balance of these microorganisms in our guts too. Dysbiosis typically occurs, when the gut bacteria, which mostly are present in the large intestines, sometimes migrate to the small intestines. So the bacteria are like completely imbalanced. A bacterial overgrowth can actually break down the undigested food in your small intestines, which produce hydrogen. However, hydrogen may feed on other small organisms in your small intestine and produce methane. So this results in excess of hydrogen, methane, or both trapped in your digestive tract and obviously causing bloating, pain, and indigestion. There is another reason why women mostly have, this digestive issues and the bloating. That's mainly because our system, the colon per se, is made in such a way that we retain a lot of fluid. You know, there's another reason why bloating can happen. That is estrogen dominance. And as most of us know, endometriosis is a condition which has estrogen dominance. The endo lesions themselves create estrogen. Also, because of the gut problems, the estrogen produced is not flushed out, making a person more estrogen dominant. So, high estrogen and low progesterone levels can lead to water retention and bloating. Estrogen often acts as a fluid retaining hormone, while progesterone is a diuretic. Therefore, these hormones are, if thrown off balance, creates this dreaded endobelly. What else? The next factor that comes into picture is a leaky gut. Exactly. Leaky gut. The digestive system plays a very, very important role in protecting your body from these harmful substances. So the walls of the intestine act as a barrier, controlling what enters your bloodstream and to be transported to your organs. That's how naturally we are made. So there are small gaps in the intestinal walls called as tight junctions that allow water and nutrients to pass through while blocking the passage of harmful substances. When these tight junctions of the intestinal wall becomes loose, the gut becomes more permeable, which may allow the bacteria and toxins to pass from the gut into the bloodstream. And this phenomena is commonly referred to as leaky gut. When the gut is leaky and the bacteria and toxins enter the bloodstream, it causes a widespread inflammation and possibly a trigger reaction from the immune system. So it is very obvious when you have toxins moving about in your bloodstream, the immune system would obviously start acting. So the symptoms of leaky gut syndrome include bloating, food sensitivities, fatigue, digestive issues, and skin problems. Surprisingly, the proponents claim that it is the underlying cause of all sorts of conditions, including chronic fatigue syndrome, migraines, multiple sclerosis, fibromyalgia, food sensitivities, thyroid abnormalities, mood swings, and skin conditions. But the problem is that very few scientific studies mention leaky gut syndrome. I really feel there has to be more study to be done on this particular subject because these are all symptoms which a lot of women with endometriosis face. So I think it's time that we get into this topic more in detail. The next important thing that controls the bloating is inflammation. Basically, endometriosis is an inflammatory disease with inflammation affecting the entire body and more so the pelvic region. The more the depth of the endo infiltration, the more is the bloating. Buildup of endometrial tissue, endometrial-like tissue actually, can cause inflammation in the abdomen. And this results in swelling, water retention, and bloating. The endometrial-like tissue can cover or grow into ovaries. And when this happens, the trapped blood forms cysts, which may again cause bloating. So as much as we don't like it, endobelly is a reality and we have to cope up with it. So we have we have seen what exactly goes behind causing endobelly. So now, is there something that can be done to prevent or to deal with this endobelly? Because honestly, I don't want to be bloated throughout the day, right? So let's come to how to deflate this endobelly. So if bloating is affected us and we are when we are just on period, life would have been much simpler. But bloating is common complaint that affects people across the board, no matter your age, your size, or where you are in your menstrual cycle. Blame your bloated stomach on your physical makeup, like I was just saying. Really, you can blame it on the biology. A woman's colon is 10 centimeters longer than a man's and is constantly competing for space with bladder, uterus, ovaries, and the fallopian tubes. Plus, in order to prepare us for pregnancy and subsequent extra water retention, our colons are more of a winding path with a lot of unexpected turns. So, in layman's term, we were born to bloat. The following quick tips may help people get rid of their bloated belly quickly. So, let's get on to it fast. The first thing is go for a walk. Physical activity can get the bowels moving more regularly, which can help to release excess gas and stool. Getting the bowels to move is especially important if the person is feeling constipated. A walk around the block can provide fast relief from gas pressure. The second is you can try some yoga poses. Certain yoga poses can position the muscles in the abdomen in a way that it encourages to release that excess gas from your GI tract. And this in turn can reduce the bloating. So there are certain poses like child's pose, happy baby pose, and squats that can help people relieve the buildup gas quickly. The third tip is to use peppermint capsules. So peppermint oil is something which is very helpful for indigestion and related gas issues. Peppermint works by relaxing the intestinal muscles, which allows the gas and stool to move more effectively. Anyone who is prone to heartburn should avoid peppermint. So this is something which you have to take care of. The fourth one is you can try some gas relief capsules. Simethicone pills and liquids are anti-gas medication that can help to move excess air out of your digestive tract. It is essential to take the medication according to the doctor's advice. Don't self-medicate yourself. Go to a doctor and take an advice. The fifth one is massaging your stomach. Try abdominal massages. So massaging your abdomen can help get the bowels moving. A massage that follows the path of large intestine is especially helpful. So a small tip of how you can do it is you can just place your hands just above the right hip bone, rubbing in circular motion with light pressure towards the right side of the rib cage. Rubbing straight across the upper belly area towards the left rib cage, moving slowly towards the lower the left hip bone, and repeating as necessary. So it actually you have actually massaged your entire stomach. If the massage causes any pain, make sure you stop it. Don't continue if you have pain. You should not have pain during a massage. The next one is to take a warm bath, soaking and relaxing. The heat of the bath can provide relief from sore abdomen. Relaxation can reduce stress levels, which may allow GI tract to function more effectively and help in reducing the bloating. So what I just covered were, the short-term effects of short-term tips of how you can prevent bloating. Now we will come to how you can avoid bloating in a long term. Just give me 1 second. The first reason why you can have bloating is sensitivity to food. So food sensitivity blood test is something which is recommended. Where the food intolerance starts to work in the bloated stomach is a problem. That's when you notice having excessive stomach bloat, even when you aren't eating much of anything. When living with a food intolerance, your body is not able to digest certain food ingredients like lactose, gluten, or it can be as simple as a carrot. When these foods enter your stomach, the digestive tract starts to struggle to process them, to digest them. And this work and effort creates symptoms such as bloating, excessive stomach noise, and even flatulence. And if the condition is extreme, it can go to nausea also. The stomach has to work in order to attempt to process the food. So even the small amount of problem food will cause this problem. The severity of the symptoms is determined by the severity of the food intolerance that you have. So different people have food allergies to different food. So I think it is imperative that get your food sensitivity checked. And it's not a one-time thing. I would recommend that you have to keep doing it maybe once in a year or once in 2 years, because our body composition keeps changing and your allergies also keeps changing. The second thing that you can do is to eat mindfully. A cliched, a very, very cliched thing to say, but mindfulness is something which will take you a long way to prevent bloating. Chewing slowly and more intentionally reduces the amount of air that you swallow in your food, and in turn lessens the belly bloat. Practice mindful eating by taking time to be aware of what you're eating and what it tastes like. You can also take a sip of water in between bites. So, chew your food. Chew your food really well, because when you chew, you actually, your enzyme starts working, and obviously that helps in digestion also. There's a lot of sense and science behind it. In short, it is really another way of saying slow down. Pay attention to what you're eating and focus on your act of chewing. It is easy to eat too much too quickly if you're not paying attention, which can lead to bloating, gas, heartburn, and indigestion. And indirectly, it can lead to weight gain. Mindful eating is the practice of paying attention to all aspects of your food and the process of eating. It can also reduce your stress, as being mindful tricks your brain into thinking that all is well in your world and you are no longer in a fight or a flight mode, which a lot of us operate in on a day-to-day basis. Because stress can contribute to inflammation, studies have shown that mindfulness may reduce digestive symptoms in people with ulcerative colitis and IBS also. The third, again, a cliched thing, reduce stress and anxiety. When in stress, we are on a fight or flight mode. This leads to poor digestion. Bloating is actually a very common symptom of anxiety, especially for those who have anxiety attacks. What's interesting is that many different issues in anxiety can cause bloating, including but not limited to hyperventilation. So, what exactly is hyperventilation? So, hyperventilation happens when you breathe excessively. The main reason that anxiety leads to bloating is the result of hyperventilation. What happens is you take in more air that you require, and that causes additional anxiety symptoms. But before and after hyperventilation, it's not uncommon to feel the pressure in your stomach and possibly experience burping. Even to say general air breathing. Similarly, even without hyperventilating, you may find that you start to overbreathe during anxiety attacks and swallow more oxygen than necessary, especially if you are prone to swallowing during these attacks. Swallowing oxygen is known to bloat your stomach and may lead to significant belching and stomach tension. The next very important thing that you need to be cautious about is sugar alcohol. Sugar alcohols are a category of sweet carbohydrates. Since sugar alcohols are partially resistant to digestion, they act as dietary fiber. They're also a type of FODMAP, which may cause stomach upset and bloating in some people. So several sugar alcohols are found naturally in fruit and vegetables. However, most of the processed form of sugar, such as glucose in cornstarch, are sugar alcohols. Sweetener found in sugar, like sugar-free foods like chewing gum, or examples of sugar alcohol can be like xylitol, mannitol, sorbitol. These are all sugar alcohols you need to be really careful about. If you are sensitive to it, it can lead to bloating. The fifth, I know a lot of people would really kill me for this. Eliminate carbonated drinks. So, do carbonated drinks cause gas? The short answer to this question is yes, but the longer answer is a bit complicated. The carbonated beverages can increase gas in the digestive system. The answer gets more intricate when you add sugar or artificial sweeteners into this mix. If you find you're increasingly bloated after having a diet soda, it may be because some artificial sweeteners can also cause excess gas. An overabundance of high fructose corn syrup, which is found in many regular sodas, may lead to gas and bloating. The sixth thing that you should do is take probiotics. I can't, emphasize enough on having probiotics. To maintain a good gut health, we need to get some good bacteria. Probiotics are live microorganisms that live in your digestive tract, and they give you good health benefits, primarily in large intestine. You can add yogurt or kimchi, which are good dietary sources of probiotics. The seventh thing that you can do is to avoid getting constipated. Too little fiber, too little fluids, and less physical activity can lead to constipation, which can result in bloating. To avoid this, eat diet high in fiber. So high, I mean 25 grams per day for women and 38 grams for men, from whole grains, fruits, vegetables, legumes, nuts, and seeds. Also, drink plenty of fluids. Aim to have at least 6 to 8 glasses a day of liquids a day. And aim for a physical activity of at least 30 minutes, 30 minutes a day, 5 times a week. Not asking for more. If you're eating a low fiber diet, gradually bump up your fiber level, making sure you're also drinking a lot of fluids for better tolerance. Make gradual changes to your diet, especially fiber. A sudden change in your diet can lead to bloating because your system is not used to it. So, gradually increase your dietary fiber. So, whenever you plan on going on a specific diet, do it gradually because any surprise element for your gut is something which will, lead you to have all the gut issues like bloating and diarrhea and constipation, alternating diarrhea, constipation. So, we don't want to surprise our gut. The next thing is notice if there is something specific that is causing you the symptom. A good way of doing it is making a food journal. Start eliminating what is causing the bloating: lactose, fructose, gluten, whatever. You may benefit from reducing the amount of suspected food or eating it with other food. In case of dairy, it can help you to choose aged cheese and yogurts which are lower in lactose. The 10th, the 10th tip for today is limit your sodium intake. Highly processed foods tend to be high in sodium and low in fiber, both of which can contribute to that bloated feeling. Get into the habit of reading food labels. When buying processed or canned or frozen food, shoot for no more than 500 mg of sodium per serving in any product, or a total of 1500 to 2300 mg of sodium per day. Look at labels that say sodium free, low sodium, or very low sodium. So the next thing that I want to emphasize is rule out medical conditions. Whatever I have been talking about are generic things. These are some things which can happen otherwise if you don't have medical conditions. So this is something very important. In some cases, bloating may result from a medical condition. And to get rid of this kind of a bloating, a person needs to take help from a doctor to diagnose and manage their condition. Inflammatory bowel disease may cause people to experience bloating. IBS can also cause these symptoms. Gynecological issues such as endometriosis, as I have been saying, and ovarian cysts can also cause pain, swelling, feeling of bloated in the abdominal area. People with these symptoms should discuss with their doctor, who will also want to know about any relevant family history and other medical conditions. Last but not the least, consider a low FODMAP diet. FODMAPs are a type of carbohydrate that occur in many different kinds of food. A 2012 review article of multiple studies concluded that a low FODMAP diet may improve the symptoms in at least 74% of people with IBS. Typical symptoms include bloating, flatulence, and abdominal pain. Another thing which I swear by is having water boiled with fennel and caraway seeds and having ginger tea. This has tremendously helped me to reduce my bloat. Besides that, I would say have a mix of, have 80% of good food and maybe 20% you can, try having other kinds of food. I would not say it's very difficult to completely cut down on everything, but 80% you can have the things that I have been talking about. 20% you can still experiment. For me, I rely on these remedies that I've talked about, besides shifting to a high-waist denim or a flowy dress. Please try these and do let me know what you ladies have thought about. I mean, what you ladies do if you have this bloating. Do let us know in our comments and in the feedback if there's anything specific that you do or anything specific that you want me to do. Let me just check if there are any questions or comments. Okay. Okay, so I don't see any questions per se. So if you have any questions, you can drop in the comment section, and I would be very, very happy to answer all the questions. And thank you so much for joining me today for this live session. And thanks to all our audience who are going to watch this later as a recorded session. Thank you, and see you again the next week. And in case there's something you want me to talk about, please drop in our comment section. Thank you so much. Have a lovely evening ahead, and see you. Bye-bye.